One of the questions you might be asking yourself is, why is health policy something we teach separate than health care? And why do we actually care about health policy? And one of the things, especially when we look at America, is that health policy in America is fundamentally very, very political. Um, you can, who gets what, when, where, why, and how, you can apply that to health policy and to our healthcare system. We don't have a social justice system of healthcare. We have a market justice system of healthcare. So whoever has the most resources gets the access to most health. This is very different than every other country. Every other country has a minimum standard of health to which everybody, through either a universal healthcare system or through specific localities helping to pay through taxes or through workers' money, pays for health care. We do not have that. We don't have a minimum standard, and we have huge health disparities. We're putting more money into healthcare and getting less and less good outcomes compared to every other developed country. We are actually going down in life expectancy, just one of the ways to measure health policy and health outcomes. So it is inherently political. It is inherently about the individual. It is inherently a very difficult thing to change, in part because of our system, which is sort of local, state, federal. One of the reasons why you as a health administrator have to know about health policy is because you have to sort of anticipate how every health policy will impact your patients, your providers, your payment system, and your institution, and the community that you serve. So you have to sort of be proactive, but you also have to not just be proactive, but you also have to react and know what policies do what. You also have to be able to impact what policies go through. You might be asked to be a witness or give testimony as to what impact policies might have on your community. You might also be part of the policy process that says, you know what, we're going to have a soda tax, but we're also going to make sure that other items in the store where the soda is taxed are cheaper and have less sugar, and we introduce them to the population. Right? So, I mean, you can do those kinds of things as opposed to letting a politician say, we're just going to have a soda tax. That's not necessarily the best way, as we saw in Chicago, to roll out a health policy, okay? So it is inherently political. Every health policy, from public health to individual health in America, it tends to follow a public policy process. So there's a policy process through which all health policy goes. There's a lot of players. We're going to talk about that. Costs are extremely important. We pay the most money in. It is almost 20% of our gross domestic product. It's going to be more because older people who are by their very nature sicker are coming into the system, and they will impact the cost. We have to look at who pays for that cost and why, and do we want to make sure that it's equal costs or just, you pay as you go. We also want to keep in mind, though, and I think this is something very, very important, there is no one solution. There's no one program that will solve everything. There is no one intervention that's going to make everything better, and there's no one-off. So we do one program and we're solved, because health is changing. Healthcare policy has to be reactive and proactive at the same time. What this class is going to be about is who are the players that you always have to consider and think about when you are either analyzing health policy and how it's impacting you, or when you're part of the health policy process and trying to enact health policy. So it's always changing. Money is really important. The role of the individual is very important. And you have to pay attention to the actors, because all of them can be good, bad, or indifferent for you making positive change for your community and for those you serve. And you help to make sure that everyone has a minimum standard of health.